that partnership, as well as his strong support for programs that help address our behavioral health crisis in this region, is County Supervisor Nathan Fletcher. And I would add that Supervisor Fletcher, since he has been elected, has really hit the ground running. And Supervisor, is exact these type of partnerships where we're going to make a difference in people's lives. So please help me welcome County Supervisor Nathan Fletcher.
Thank you, Mayor. Thank you, Mayor. Thank you, Mayor Faulkner. Good morning. I want to just say a word that I appreciate the commitment of Mayor Faulkner to these issues, and I appreciate the work that we are doing together. You know, so often when you confront problems, it's like one entity or one group tells the other that there's a leak in your side of the boat. But the reality is we're all in this boat together, and we all have to work together to try and address the very significant issues that our region faces. And today is yet another step forward in that effort. Today we show the city and the county working together to drive real action to tackle the homeless challenge, provide more efficient and more effective mental health services to those most in need. And this really is a collaborative effort between AMR and our ambulance providers, between our fire rescue folks, between the city of San Diego and the county of San Diego. There's an African proverb that tells us if you want to go fast, go alone. If you want to go far, go together. And with all of these folks standing together and moving together, I believe we can go very far in addressing the challenges that our neighborhoods and our communities and our regions face and helping those who so desperately need help and assistance and care. I want to thank Assistant Chief Chris Weber for hosting us here at Fire Rescue Station 1. AMR paramedic Sean Percival, thank you for joining us. We're going to hear about his experience being out on the streets. The director of the county's psychiatric emergency response PERT team, Dr. Marvin, is here. It is very difficult work that our EMT folks and our PERT team members do every single day. It's often thankless work, and we want them to know that they are appreciated, that they are supported, and that we are working to try and build out a system of care to meet the need that's there. I'm pleased to see the county back committed to this program and the city together. And we're pushing on a number of fronts. The budget that the county will consider tomorrow represents one of the single largest increases in behavioral health services in the history of San Diego County. We're looking at collaborative efforts we can do in partnership with the city at our Rosecrans place in Hillcrest and throughout the region so that we can really work together to have a partnership that exemplifies a spirit of cooperation, a spirit of progress, but most importantly for the folks who are in neighborhoods who are impacted by this, a spirit of action. Of real sustained progress with each one of these individual things being a piece of a broader puzzle to make a real difference. 100% of my county supervisorial district overlaps with the city of San Diego. And when I took office, one of our aims was to partner with the city, to partner with Mayor Faulkner, to partner with the council, to really begin to address our regional needs together. And we have done that in a number of things, on homelessness, on community centers, on more reliable transit. We're trying to work together on clean energy. And today is very much a continuation of that spirit of us working together. Our region needs action tackling the challenges facing our most vulnerable residents. This can be an example not only for the rest of our region, but for the rest of California, where we have teams of trained medical professionals through this program who can move quickly to help people experiencing homelessness, behavioral health emergencies, and other trauma-induced situations, while simultaneously reducing the burden on our 911 system and getting these folks into the most appropriate level of care in a way that can sustain much better outcomes and potentially be a savings to the taxpayers. That is connecting them to the individual care that they need. This targeted approach will provide better outcomes, and by taking action, we're working smarter. We're being more efficient with the resources available, and we're targeting those services that make sense. So again, I'm incredibly grateful for Mayor Faulkner for his leadership and willingness to stick with this. I'm incredibly grateful for our county staff and workers who are here, and all of our first responders who really are trying to do the right thing. And so today is a good day. It's a day of action. It's a day of progress. It's a day of cooperation and coordination. and a day that we certainly all want to see replicated in many other fields as we try and make San Diego a better place. So thank you, Mayor Faulkner, and everyone. Thank you.
Thank you, Supervisor.